Margie here. Hormone replacement therapy is a question I am asked about all the time. And there's so much misinformation. Well, today we're going to delve into this topic and we're going to answer the questions. Number one, is hormone replacement safe? And is it safe for people who've been 10 to 15 years post-menopause? Number two, how long can you be on hormone replacement? Number three, what do you do if you have vaginal dryness? Is there something that can be helpful? And number four, what about if I don't want to be on hormone replacement therapy, but what can I do? Are there other things I could take that could be helpful? So we're going to go through all of this with our very special guest, Dr. Tabatha Barber. And Dr. Tabatha is a highly sought after physician, speaker, and two-time best-selling author who's dedicated her life to empowering women in their health journeys. She holds triple board certifications in obstetrics and gynecology, menopause, and functional medicine. Her virtual medical practice offers compassionate care to women across the nation, and she inspires thousands to heal by focusing on within and focusing on gut health, hormone balance, and soul nourishment. And I've known Dr. Tabatha for many years. She's very special, and I think this just phenomenal information in this episode. So stay tuned. Welcome, Dr. Tabatha. I'm so happy to have you back on the podcast.
Oh, Margie, I always love talking to you. We think alike on so many things and we're on the same mission. So thank you for having me.
Oh, always. And I just have to say before we get started, I am so excited about your summit. It's, yeah, you want to, well, we'll talk about it afterwards, but it's just, you want to just mention what it is? It's really exciting.
Yeah, I think it's for every woman over 40. If you're north of 40, this summit is for you. It's called the Midlife Reset. And I really wanted to bring together experts who are looking for those deeper root causes of why women are struggling in midlife and beyond, but also the mind, body, spirit connection, because you are a whole person. You are more than your physical body. You're more than your symptoms and your diagnoses. And so we need to talk about nurturing your spirit and your relationships and your finances and all of those things. So that is what's happening on the summit. It is absolutely free and it's going to be a game changer.
Yeah, no, I'm so excited. And that's, I think, where you and I are on the same page because so often people want to focus, which both of us do, on functional root causes, on everything else, but we can't forget this other piece. And it's so powerful when you bring that in. I think that's when the magic happens. So I'm so excited. I loved our interview. It's always fun talking to you about bones and what people can do. So yeah, I can't wait for the summit. Anyway, today we're talking about hormones, and there are so many questions, Dr. Tabatha, in my community. And, you being a functional gynecologist, which I'm going to have you explain in a minute, you come from a different perspective. And I just think you're the perfect person to answer a lot of these questions that, are in people's heads. So thank you again for being here.
Yeah.
Let's start out before we even get started, just explain the difference because, a lot of people are seeing their gynecologist. And what is the difference between what you do as a functional gynecologist than what maybe the conventional gynecologist will do in terms of the care?
Yeah, so I was a traditionally trained Western doctor. I was an OBGYN. I practiced for over a decade. I delivered babies, did hysterectomies, ablations, colposcopies, pap smears, all the regular things, right? And I inherited I inherited a practice from an older gentleman doctor who was retiring at the age of 74. So he had been with his patients for a long, long time, and he had them on hormone replacement therapy. And mind you, this is after 2002 when that amazing study came out and scared everybody, saying like estrogen causes cancer. And overnight, our country went berserk and scared everybody off of their hormones. Doctors stopped prescribing it because they didn't want to get sued. And unfortunately, that wasn't actually what the study showed. But once that narrative was out in the media and the public, everybody ran with it. And there was no putting the jack back in the box. Like it was out, it was there. But I inherited this practice from a really brilliant doctor who knew better, and he knew that study wasn't true. And so I inherited all these beautiful women over 40, over 50, in their 70s and 80s, still on HRT of one form or another. And I learned so much from them over a decade. It was absolutely incredible because I would watch how they would feel and function compared to my colleagues and how their patients were doing with the same issues without hormone replacement therapy. And so I never really feared hormones the way all of my colleagues did. And so that kind of set me apart, initially. But I just want to emphasize the fact that just because a doctor recommends something or recommends against something, that doesn't necessarily make it true and correct and real. So that's what I want women to get through in their minds, is that they should be their own health detective and they should be their own health CEO. You need to be your own advocate and do the research, because a lot of doctors, they come out of medical school and residency having learned certain things and certain beliefs, and then that is how they practice until they retire, and they don't continue to evolve or question or use critical thinking of, like, is this actually the best situation? And I happily went along with how I was practicing for a long time, and the hormones were great. But what I often talk about is I practiced a lot of Band-Aid medicine. Even HRT is a Band-Aid, because we're just covering up symptoms that women are struggling with. And so you're having hot flashes, night sweats, different things. Yes, hormone replacement therapy helps, but there might be another deeper reason you're struggling with these, especially if you've already gone through the transition. Say you went into menopause at 52 and now you're 62 and you're still having hot flashes at night, or you're still struggling with your weight, or you're losing bone at an accelerated rate. There's a deeper reason for that. You don't just need HRT. And so when I went on to study functional medicine and heal my own body, I learned all of this, and it was so eye-opening to realize, like, wait a second, there's so much more to the story than I learned in medical school and residency. I almost felt gypped, you know what I mean?
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show. I do, and that's why I'm so passionate about this functional approach and looking at root causes, because just like with bone loss, there's so much more than just shows up on the DEXA. And unless you really do this deeper work, people they may get their symptoms or their bone density may get a little bit better, but to truly heal and to truly thrive as people get older, you need to dig deeper and get these underlying symptoms. So that's why I love the work that you do, where you do look at root causes and what's going on. And You know, it's so interesting though what you're saying that, you had patients in those days where nobody was put on HRT. So you saw the difference, but what did you see with the bone health in terms of the people who were on the hormone replacement and those who weren't? Did you see a big difference?
Yeah, that one was a huge difference. That and heart disease, diabetes, things like that, metabolic health. So I saw definitely less osteopenia and osteoporosis, less fragility fractures, just less fractures overall. And when it comes to, being on hormone replacement therapy, like I said, it can be a Band-Aid, but it's supporting your body's overall ability to function. So, when women are going through this transition or they've gone through this transition, oftentimes no one explains to them that estrogen was keeping them in this other state of health and wellness because it was supporting our bones' ability to turn over and make new bone and not break down, and it supports our arteries to stay elastic and mobile so that we can pump our blood through our body. And it helps our cells bring vitamins and minerals inside and outside of the cells. And when you don't have all of that, you start to see insulin resistance from that cellular inflammation. You start to see elevated blood pressure and hypertension in your arteries. And then you start to see the bone loss in your bones. And we all know what we see on our skin. We see loss of collagen. We see loss of volume. We see the wrinkles coming. I remember the morning I woke up and looked in the mirror and I thought I saw my mom. Like, it was just overnight, this change that happened. I was like, "Oh my gosh." But that is what happens when the estrogen goes away. And so what I tell women is you have two things you can do essentially. You can figure out how to make the best of your new body and brain without all of that estrogen, or you can replace it and kind of suspend yourself in that 48, 50-year-old body as best you can and with hormone replacement therapy. So it's like a fork in the road. And what I saw a lot of was patients didn't get that conversation. They didn't get that opportunity. Nobody said, you have this opportunity. And so now we have a generation of women who had their hormones taken away back in 2002, who were forced to go through menopause without any hormone support. And now they're suffering the sequelae. And luckily, they're finding women like you and providers who can help with all of these other systems to make the most of not having estrogen. But it's important to understand that the research does show once you get around the 7 to 10 year mark of not having that level of estrogen, things do shift and you can't get it completely back. So that's what I do see is women will come to me at 65 or 70 and say, I want to go on estrogen. I just heard like this is what I need to do to not get heart disease and bone loss. But meanwhile, all of those disease processes have already set in and she's already got those things going on. And so estrogen isn't magically going to reverse all of that at that point, but I think we should talk about what it can do for you going forward if that's something that you want support with. Does that make sense?
Yes, absolutely, because I think now a lot of people are realizing that so much of bone loss can be prevented if people, as soon as, they start going through premenopause, perimenopause, we can work on the hormones. We really can make a huge dent in bone loss because estrogen really helps prevent bone loss and maintain bone. And so, but yes, that is the question now. People are you know, the big question that I get all the time, because a lot of times the doctors will say, if you're 10 years post, if you're 10 years post menopause, I don't even know if it's safe. And they really question. So that's what people are thinking. Is it really safe after menopause? Maybe the person after menopause, it wasn't offered, it wasn't thought about. And that's my generation. I'm 66. And, it wasn't even something that people really promoted at the time. And so, yeah. So why don't you share about that? Like, because people
Yeah.
think that's the big question. Is it safe? And are there, let's start with that in terms of, is it safe after menopause?
So, what we know is from the studies that were done, I need to clarify because the big study that everybody talks about, the WHI, the Women's Health Initiative, those were done with synthetic hormones. They were done with conjugated equine estrogen, which is made from pregnant horse urine. They take the pregnant horse urine and distill the estrogen out, and that's what they would give us. And then synthetic progestins. So, a progestin is like progesterone. Progesterone is the natural hormone that we make up until menopause. A progestin is a little different. So it's a medication. It's not chemically the same. So it does certain things in our body the same as progesterone, meaning it prevents the lining in the uterus from overgrowing too much. It keeps that lining in check. And that's what you want because estrogen makes that lining grow. Estrogen is a growth hormone, and progesterone comes in and stabilizes it. So, progestins do a good job at that. But where they act different is in the rest of our body, especially our brain. They actually don't feel the same in our brain. Progesterone, our natural hormone, calms our anxiety. It's like our natural anti-anxiety hormone. It really makes us feel good. It helps us sleep really well and feel good through the day. Whereas progestins, they often make women feel more anxious and or feel depressed and or flat, even like they don't feel anything. And it's associated oftentimes with weight gain. So we don't love progestins. Another reason I don't love progestins is that study showed there was a small increased risk of breast cancer. That is where the fear came from, was actually the estrogen plus progestin part of that study. There was an extra 8 women per 10,000 women. So it wasn't a huge increase, but it was a slight increase. And it was because of the progestin in it, not the estrogen. The estrogen only group actually had fewer cases of breast cancer. But the the bigger issue is that oral estrogen, if you take it as a pill, it has to pass through the liver when you absorb it in your gut. And if you have any kind of clotting disorder or history of blood clots, that can potentially increase those risks. There has not been a single study that has shown that to be true with transdermal estrogen, like a patch or a cream or a pellet. We just don't see that blood clot and stroke risk with transdermal estrogen. And so we have to understand, is your doctor talking about synthetic hormones? Are they talking about bioidentical, which means they're just like the kind your body makes? So the cool thing now is that we can actually get the estrogen that our body makes. It's called estradiol. We don't have to use that horse urine anymore. That's Premarin and Prempro. But I will tell you, when I took care of those women in that practice for a decade, a lot of them were on Premarin and Prempro, and they still were happy and still lived an amazing life. So even the synthetic hormones aren't as bad as no hormones. Like, that's the crazy part to me. So there's good, better, and not so good. You know what I mean?
Yeah, and the interesting thing now, though, is that, some people are always, "Oh, I have to go to compounding pharmacies." You can just get a prescription for these medications now, correct? And a lot of that's covered by insurance?
Yeah, that is such an important point. Really, compounding should be left for when you can't get it by standard prescription. That should be your first line because there are really good options. You can get bioidentical progesterone in a capsule in 100 milligrams or 200 milligrams from any old pharmacy, the Walgreens, CVS, all the places. And then you can get an estradiol patch. It comes in a very small dose, a 0.025 milligram up to a zero point 0.1 milligram, and everything in between. So there's a lot of options on there. And if people don't tolerate those for one reason or another, then we can start looking at compounding in using creams or troches, which are things you put in your mouth and you suck on like a lozenge. There's pellets, different things like that. So there's many options out there. And what I always say to women is find a provider who understands all of the nuances of this because they're actually going to give you what's best for you. Because if you go to a cookie cutter, quote unquote, hormone specialist, and they only do it one way, like if they only do pellets, they're not really going to help you. The majority of women actually don't do well on pellets. There's a very small amount of women who do well on pellets, but there are a lot of places who say, I'm a hormone expert, and that is all they do is pellets. They don't understand how to dose creams or use standard prescriptions covered by your insurance or anything like that. And so that, I would say, look for that if you are looking for someone to help you with hormone replacement therapy.
I couldn't agree more because it's not something that you can be in a big group and then someone just prescribes it. To me, the only way I've seen it really successful is when someone is working with someone and then they can look at the person individually, figure out what's best, do the proper testing, which we'll talk about in a minute, because it's not just one size fits all. There's so many intricacies, and someone like you who's done this for so many years knows what to, all these details, but it's not as simple as just throwing somebody on something.
I would love to add that the compounded creams can be super helpful when it comes to vaginal health and bladder health because there are standard prescription estrogen creams on the market, but unfortunately, the base that they put them in has polyethylene glycol, which is a drying agent. And so it might help initially, but then a lot of women feel like their condition worsens over time and they require more of the cream. And they're just, as soon as it wears off, they feel extra dry. And it's because of that darn base and the cream. And so, I appreciate that they made this product, but if they would switch out the base, that would be really helpful. So if you have it compounded, they can make it in something that doesn't dry the vaginal skin out and make the issue actually worse. So that is when I like to use compounding pharmacies, is when we're dealing with anything vaginally related. And you've probably heard it from your ladies. That stuff sometimes doesn't creep in until 5 or 10 years after menopause. And all of a sudden, like they can't have sex anymore because it feels like razor blades, or they're having bladder leakage, or they're having urgency and feel like they can't hold their bladder. And that really is because of that loss of estrogen. Estrogen keeps that tissue very elastic and moist and mobile, but it also creates a mucus barrier with bacteria. And when you don't have the estrogen anymore, the bacteria in our vagina shift, and then it's less acidic down there, and we have this propensity to have bacterial overgrowth, like bacterial vaginosis and yeast. And so estrogen really does a good job of keeping that microbiome, or we call it flora in the vagina. I don't know why we call it flora, but keeping that in balance. And so it can be really helpful for women who didn't go on systemic hormone replacement therapy, but now they want that local support. That can be super helpful because recurrent bladder infections are one of the number one causes of women ending up in the hospital in the ICU with sepsis, and even increased risk of death. So it is a big deal.
I just want to talk a little more about this because people don't realize, even if you've never been on hormones, and this is something universal, conventional doctors, everybody, nobody has any issues. Am I right, Dr. Tabitha? With vaginal ultrasound. I'm not ultrasound, the vaginal estrogen, using it, topically in the
Yes, even if you have had breast cancer or other cancers, your oncologist should be fine with that. That has been made clear in the research, and our societies are now supporting that declaration. The Menopause Society, the American College of OBGYNs, like vaginal estrogen is safe for women.
Right. So even if you're somebody who really doesn't want to go on, or you can't, this is something that you can use. But this is a very interesting point that you're saying about the difference between just getting the prescription, which what is it, the estradiol cream, the prescription that your gynecologist might give you? What would they give you for the vaginal ultrasound?
Yeah, the generic is estradiol cream, the brand name is Estrace.
Right. So for people listening who are like, yeah, it bothered me, I couldn't tolerate it. What exactly do you ask for when you talk to your doctor?
Well, the problem is OBGYNs aren't trained in how to write compounding prescriptions, so they wouldn't even know where to begin with that. I had to go through extra training through, the A4M Academy to do compounding prescriptions. So that's another piece of it. What they typically would do is try another form. So there are also vaginal rings made of silicone that you can insert and leave in for 3 months at a time that slowly releases estradiol on a regular basis. There are little tablets that you use an applicator and pop that in the vagina at bedtime. Um, Everybody is so unique. I have heard it all. Like some people love the ring, some people hate the rings. Most people don't think the tablets do anything. I used to do, physical exams all day long, and I would see those pellets just sitting in the vagina. They didn't even dissolve. I'm like, what a waste this is.
So basically, they really need to work with a functional practitioner who knows how to do the compounding if they want what you're saying to get the compounded that doesn't have the what you're talking about, the drying agents in them. Is that correct? Did I get
Yeah, or find a gynecologist who has gone on to do more training with A4M or the Menopause Society. Used to be the North American Menopause Society. They just rebranded. But somebody who has gone above and beyond their normal 4-year residency, because honestly, OBGYNs are surgeons. I spent 4 years learning how to be a surgeon. I didn't spend 4 years learning, the intricacies of hormone balance and menopause. I learned nothing about nutrition, any of that. Like I had to learn all of that after the fact.
Yeah, no, absolutely. And the other complaint sometimes I hear about, though, is the opposite, is that people will use the estradiol cream and they end up getting yeast infections from that, from the prescription estradiol. What would be causing that?
Yeah, so if it's that standard prescription cream, that drying agent really destroys the good beneficial bacteria that we need to have in the vagina. We need the lactobacillus and the different bacteria in there. I know it's a weird thing, but I promise you, bacteria keeps you healthy, just like we need certain bacteria in our gut, certain bacteria on our skin. And if those get killed off, the yeast take that opportunity to overgrow and multiply. That's why when you get an antibiotic for your bladder infection, you almost always get a yeast infection because you killed off all the good bacteria in your vagina. So it's just, this balance you're looking for.
Yeah, well, that's such good information because a lot of people just said, I'm not doing this. I don't want a yeast infection, and not realizing it was just the prescription cream versus that you could get a compounded cream that won't happen. So interesting. Wow. The biggest question I get, Dr. Tabitha, is okay, well, how long is it safe to be on the hormone replacement? That is a question everyone says. Do I need to get off? I've been on X amount of years. What's your thought on that?
The $1,000,000 question. The hormones, you should stay on them as long as you want the benefits. There is no literature that shows there's a certain age you need to stop them at. That is an outdated recommendation that has been completely debunked. There's just no truth behind it. We were scared for a long time because of the misrepresentation of that study, the Women's Health Initiative. And so doctors didn't question, they just went along with the narrative. And now people have started to question, and I'm so excited to see like big name people coming out and saying that was wrong. Like, we're no longer going to accept these lies. And so you can feel comfortable with using estrogen and progesterone and testosterone until you pass on into your next life. Like, there's no reason to stop. And as I mentioned, I had some older ladies in my practice, and I did a lot of pessary care. So pessary is a device that you use for uterine prolapse, rectocele, cystocele, like your bladder or your rectum are falling into your vagina. So I did a ton of vaginal care. And I loved seeing the women who are in their 80s who were on systemic hormones or at least on vaginal hormones, and they were still having sex with their husband. They were still playing pickleball, and they had less pessary issues or didn't even need the pessaries, unlike the women who weren't using any kind of hormone replacement therapy. So there was such a huge, uh, difference in those populations. And I would just say to myself, like, when I need to be on hormones, I'm gonna be on them forever because these women are happy, they are loving their life, they're loving their husbands, and they're way more active. They are out there physically active, and that is what keeps you healthy. And so if you're having joint pain and your muscles, are spasming and stiff, and you're not moving your body because you're struggling with menopause, like, that's gonna age you and create disease quicker than anything else, so we need to combat that.
So the person who is, 'cause a lot of people in this community who are, at least 15 years past menopause, what testing should they do? What testing should their doctor do to make sure it wouldn't be contraindicated for them? There are certain testing that you make them go through prior to this?
So here's the deal. When we go through menopause, our ovaries, which are the little factories that make our estrogen and progesterone, they close shop permanently. The workers go home, the factory closes, and those ovaries shrivel up to the size of like an almond. And so I don't need to test and see that you don't have any estrogen and progesterone. I know that you don't if you have been menopausal for 15 years. But our adrenals are our backup ovaries. So our adrenal glands not only make our stress hormone cortisol, but they also make our anti-aging regenerative hormone DHEA. DHEA and cortisol kind of balance each other out. But they also make testosterone, and testosterone is a vital part of continuing to have a thriving menopausal life because testosterone keeps your muscle mass around so that you don't lose that strength to support your bones. It gives you drive, not just sex drive. I wish people would quit talking about that because it's drive for life. It gets you motivated to get out of your bed and go do your day. So, testosterone can be really beneficial for menopausal women. And so, I do like to check those levels. And even though I said I don't typically check estradiol because I know you're not making it anymore. I do check it with estrone. Estrone is a different form of estrogen that our fat cells make. And here's what's really cool. You probably already know this, Margie, but like God knows how to create our body. We make more fat cells after menopause to have that estrone so that we have a little bit of estrogen in menopause to continue supporting our bones and our brain and our heart. And so when we put on 5 or 10 pounds at menopause, it's because our body's trying to produce estrogen in a new way. So here we are mad at our body, think it's working against us, and why is it betraying us when truthfully, it's trying to support you in your menopausal state and give you what you need, but we don't see it that way. And so I like to get an estrone level and see how active are those fat cells. And to me, it's like Goldilocks. You want it to be just right. Too high is really bad, too low can be really bad. So, if you have too much estrone, then you're at risk for uterine cancer. That's obesity is like the number one risk factor for uterine cancer because it's growing that lining in the uterus from that estrone. So, you do want to have a little estrone, but you don't want to have too much. And here's what I learned when I studied functional medicine that I did not know as an OBGYN. Our gut has bacteria that increases our estrone levels. It makes an enzyme called beta glucuronidase that will actually cut the garbage tag off the estrogen we're trying to poop out and get rid of that we've used up and make us recycle it and reuse it. That is our body's innate intelligence saying, I need to keep that estrogen around. I need it some more because we're just not making it anymore. But if you have too much of it, then that can start to be a risk factor for other things like colon cancer. So it's really cool that you can do a stool test and see how you're metabolizing your estrogens and how they're affecting you in menopause. Like, there is way more to the story than I learned as an OBGYN. And so I want women to realize that there's more answers. It is way more deeper than we give it credit for. OBGYNs are looking on the surface and they're just focused on hormones. They're not looking at your gut, they're not looking at your adrenals or anything else, and it's all interconnected. So that's why I was like, I got to do this summit. I have to help women realize, like, this is all connected. If your thyroid is acting in a certain way, it's because of, something else in a different system. So I could go on all day. It's incredible. Like, everything I've learned, I'm just so excited to share it with everybody.
I just love this because for those who even aren't on hormones, what you're saying is your cortisol level, your adrenals, all of these are going to impact your hormone balance and have so many effects for your bones, every aspect of your body. So it goes so much deeper. And that's, I think, the beautiful thing that when you practice this way, just everything gets better, right? It's so exciting. And you just want everybody, and that's how I felt about my summit too. It's like, I want everybody to learn all this because it can, and what I like also about summits, it's a smorgasbord because everybody needs something different. And
Yeah.
you have all of these options. If this is your issue, you can focus on that. If this is your issue. And so I'm a huge fan of summits. And I think they're just life-changing because it gives you an opportunity to really learn about something maybe you don't know. But one thing I want to talk about is a lot of people in this community aren't going to go on hormone replacements, but they might do DHEA or maca. So what have you found helpful in that has been helping people with their hormone balance besides the hormone replacement? Are there any little tricks and tools that you've seen?
Yeah, I mean, I love definitely DHEA and maca. Those are two of my go-tos. Sometimes I'll use pregnenolone as well. So if you wanted to Google the steroid pathway for hormones, you would see that the first thing that we need to make hormones is cholesterol. So we need good, healthy fats in our diet. Please don't listen to the low fat, no fat diet recommendations. That has been debunked. That destroyed our health, actually. We need good, healthy fats like olive oil. We need to eat olives, coconut oil, nuts and seeds, avocados, grass-fed butter. That cholesterol backbone helps us make hormones after menopause. But even more so, cholesterol is actually the foundation of all the trillions of cells that make up our body. So we have a biphospholipid layer of our cells, and things can't go in and out of the cells without cholesterol. So please don't be afraid of cholesterol. And that was one of the things I needed to hit on the summit, was helping women understand cholesterol, because we are getting women put on statins and these other drugs, and they're having such terrible side effects like muscle cramps and not being able to exercise, which impacts their bone health. And like, it's just this domino effect. So we really do need to understand these things. And so if you look at that chart, after cholesterol, our body makes pregnenolone, and that's kind of like our parent hormone. Pregnenolone can be made into many different things, and you can buy pregnenolone as a supplement over the counter, just like you can DHEA. And both of those can be really helpful. You can measure your DHEA sulfate level in blood. Ask your doctor, please get me this level. And if it's under 80 to 100, then you probably would benefit from some supplementation. I honestly try to keep it really low dose, 5 milligrams, 10 milligrams. Higher doses can be associated with hair loss, so we don't want to go there. There's always that sweet balance, because it's restoring and it's regenerating. And so sometimes it will kick your hair into the shed cycle in excess if you're really trying to like clean house in your body. Just like if you do an extended fast or something, you might lose some hair. Just like after you have a baby, that shift happens and you lose all the hair. So keep the DHE level low. A little bit of supplementation goes a long way, and it helps women who are tired, who don't have the energy during the day, or who are slow healers. Maybe you've had a fracture or an ankle sprain or something. DHEA is like your healing regenerative hormone. So I love DHEA. And for me, like, it is all about your gut health and your diet, because your gut health determines your overall health. So I really love to focus on healthy fats, clean proteins, getting that standard American diet out of your life. Stop eating omega-6 fatty acids. If you are eating seed oils, you're going to age. They're going to destroy you. And the last thing I want to say about bone health is, please stop drinking Diet Pop. Like, don't drink the Coke Zero, the Diet Coke, all those artificial sweeteners. They are pulling all of the calcium out of your bones. They're pulling out the phosphorus and the magnesium, and your poor bones are just screaming. So that stuff will destroy you quicker than anything else. Like, learn how to love water. If you want to flavor it naturally with lemon, I mean, there's so many options out there now. Like, there's literally no excuse to drink that toxic stuff anymore.
Yeah, I totally couldn't agree with you more. So a couple things. So we'll have the link for the summit. Is there anything else you want to share about the summit? How many days it is? Just give people a little more info on this summit coming up. And I'll have the links so that people, because it's free, which I love.
Yes, oh my goodness. Sign up. There's no reason not to. It is 5 days. There's 50 speakers, and I really wanted this to nurture and talk to women's souls, because what I've seen is that we get really fixated on trying to make our bodies strong and resilient and healthy, but sometimes we neglect what's going on under the surface, the emotional stuff or the traumas that we've had, or the soul's desire to go out and do something, but life keeps us stuck and we can't actually follow our dreams. And like, all of that needs to be addressed, because if it's not, it will permeate and destroy you physically. I promise you, it's all connected. And we're going to help you understand that, because we have some amazing speakers who are talking about the mind body spirit connection, and how the body does keep the score, and how we can work to release that stuff. And that might be why you're stuck and not shifting physically. It might be something like spiritually or mentally that you need to deal with. You might not just need to shift your vitamin D level. It can be so much deeper. So September 22nd to the 26th. You can go watch all those recordings. I'm just so excited. I'm over the moon about it. There's live calls every day, so you can ask me questions, because obviously when you learn something, then that's going to stimulate more questions for you. So we are here to coach you through it. It's going to be really exciting.
Oh, Dr. Tabitha, I'm so excited about this because you are very much in the mindset that I am. And many people are so, especially when you have bone loss. I want to do the right exercise. I want the right supplements. Do I go on medicine? Do I not? There are many questions. And yes, hormones not. But this other piece is just as important. And it might be what is keeping you stuck. So I love that that is a big part of the summit besides everything else. So that's great. The other thing I want to ask you, though, which because people always ask me, "Who can I work with?" "Who can I work with?" But you not tell people where you work physically, but you also have license to work as an MD with people, um, right? Virtually, you have
Yes.
so tell everybody where, because I always forget. People ask me, "Do I know a doctor in this?" And I'm thinking, "Where's Dr. Tabitha?" I always where your places are.
Well, I'm gonna make it easy for you, Margie. So we put a map on our
Oh,
website.
good.
We
Oh,
just
perfect.
made all the states pink that I'm licensed in, because it is over half the country and I couldn't possibly list them all off. And so if you go to drtabitha.com, you can find that map under work with us. And we can still work with you if we're not licensed in your state. We just can't be your prescribing physician, like for medications or hormones, things like that. But we got you covered.
Oh, that's so great because there aren't many like you. It's not that there's
I
female
know.
gynecologists everywhere. That's why I think and you and I have known each other, oh gosh, for so many years, and I just love the work you do, and I'm just so excited that you're even taking it to another level, getting involved in summits and all the education. So it's just so wonderful. Is there anything you want to leave people with? This has been so helpful. So much great
Oh,
information.
thank you. I just want to leave women with hope because when they get to me, a lot of times they have lost hope. They feel like nothing is going to work. They've tried everything. They're ready to give up. They're just going to do this one last thing, right? And you can never give up hope. That is when I worked in the hospital and people would pass on, it's because they had lost hope. And so, don't forget, like, God created your body to be healthy until your last day. He did not create you to struggle and have disease in your body. It is from the world that we live in. It is us not listening to our body. All of these symptoms are just messages. Your body's trying to tell you something. So if you can learn how to listen to your body and give it what it needs and sometimes what it's screaming for, you will shift. And so that is my hope. That is what I bring to women is let me help you understand your body and give it what it needs. You can't heal a body you hate. You have to love it and then it will change.
Couldn't agree more, and I just love the work you do, and you're just helping people all over the place. So thank you so much for taking the time to join me here today and just spread this very, very important message and all this great
Mm.
information. And good luck with the summit. I can't wait to hear afterwards. You have to contact me and just tell me all the lives that were changed. There's just nothing like it when when you've done something like this, put your heart and soul into it, and then you hear of all these great things that happen. So
You're gonna make me cry. Oh, I appreciate you so much. You are a shining light. Thank you.
thanks so much. Great to see you. Wow, there was so much great information that Dr. Tabitha presented. All the links to her summit and her website will be in the show notes. And please share this episode with anyone you think can benefit. So thank you so much for tuning in, and I look forward to seeing you on the next episode.